Hi guys, Bridget's here at Canna Patient Resource Connection, Ganja for Autoimmune Arthritis. Here doing a really quick video on what's the difference between medical and recreational cannabis and why is it important. And that's actually the bigger question, is why is it important that we separate out the two. A lot of times you'll see somebody whose child has epilepsy or something post about losing access to medical marijuana because recreational came in, and somebody will chime in going, "Oh, all use is medical." Okay, that's great, but that doesn't help. And then they purport to say, oh, if we just make it legal for everybody recreationally, it's all going to work out and these patients will have access. That isn't the case. And these two absolutely need to be separated out, especially when it comes to legislation. So what's the difference between recreational and medical cannabis? As far as the plant goes, not a darn thing. The same stuff that's sold in your medical shop is the same stuff sold in your recreational. The differences are going to be in how much you can buy, how much you're going to pay, and the selection that you have when it comes to dispensaries. The medical stores, for the most part, should have a wider variety of different ratioed strains to treat a wide variety of ailments for their patients, and then theoretically. And then the recreational shop should have more high THC content, because the goal with recreational is to get high. So theoretically, what's the difference between medical and recreational? Theoretically, the difference is just whether or not you're trying to get high or whether or not you're trying to heal. That's the difference. The difference is really more mental than it is anything else. But why is it important that we separate these things out legislatively? A medical patient is not going to have access in your recreational market because of your taxes. You notice how I said the recreational market and how much you're going to pay is one of those big differences. Right now it is so heavily taxed that patients, there's no way they could afford their dosing. So just to kind of give you an idea, recreational use is more like wine. You know, you're using it socially, you're using it with your friends, you're using it, you're like, woo, I'm going to take this bong rip and post it on the web, woo, that's so cool. That's recreational use. If you're sitting there, you know, you're gathering with your friends and you're in your backyard and you're passing a joint, that's recreational use. You're using it to have fun. You're using it just like you would wine. Of course, it's safer, with a lot better benefits than wine, but that is recreational use. Medicinal use, on the other hand, doesn't give a rat's ass about how high you get. The idea is to control the symptoms of a disease. And unless you're using cannabis with that in mind, regardless of what dosing you use or what method you use, you're using recreationally. So if you're using it out with your friends and you're doing all that sort of stuff, you're using it recreationally at that point. But if you're at home and you're coming up with dosing, you're experimenting, you're trying to figure out specifically what's going to help your disease, that's medical use. And really, just to give you an idea, Dr. Raphael Mechoulam is the Israeli scientist who discovered THC. We should all know who Dr. Raphael Mechoulam is. He's the reason we all know about your endocannabinoid system. So he came up with some mammalian dosing schemes that he uses in his hospitals and in his experiments and things like that. And so we generally tend to stick to that as far as it goes. And those dosing schemes are 1 milligram per kilogram, just as a maintenance dose, or for something incredibly, incredibly mild. 5 milligrams per kilogram if you're kind of in moderate disease activity, 10 milligrams per kilogram if you're in severe disease activity. The whole cancer dosing of 1 gram a day is bogus. There are so many flaws with that, it's not even funny, and that'll be a whole separate video just in itself. But there is actually a dosing for cancer that needs to be followed, not necessarily oh, just take a gram. Okay, how many milligrams is that? I don't know. Okay, that's great. If they're bigger, they might need more. If they're smaller, they might need less. Anyway, that's a discussion for another day. But mine, I take 5 milligrams per kilogram, partly because I can't afford the 10 milligrams per kilogram, and my disease is active enough that I do need that, but I can't afford it right now. Right now, if I were to purchase my needs in a dispensary, it would be $1,500 every single month. That's right, $1,500 a month. What patient makes that? If you're sick already, you have exorbitant medical bills. You're probably paying ridiculously for health insurance. It doesn't cover much anyway. So I'm at my 5 milligram per kilogram. So this right here has roughly 50 milligrams of THC in it. This is infused coconut oil, no solvents whatsoever. And this, I take 8 of these every single day. I'm at 405 milligrams per day, and may actually try to up it just a little bit to get over this flare that I'm in. So I have all of these left to take today. This is what I have left to take today. So I have 250 milligrams left to take today. I also use this paste, which there's not very much left of. This paste is made by one of our shadow healers who is absolutely amazing. And this paste helps contribute to the layering that I use to keep my dose. I do use tinctures right here under the tongue, though I have to be really careful because I'm allergic to alcohol, unfortunately. So this one is a glycerin tincture. And just so you guys know, glycerin may help hurt the belly. Not help, it may hurt the belly. So if you have GI issues, this may not be the best tincture solvent to use if you're going to go the tincture route. But one of my favorites is topicals. And you generally don't see this with recreational use. This is my muscle rub, and I bathe in this. So in addition to the 405 milligrams of infused coconut oil I take every day, I use things like this, and this, and this, and my dab pen, in case I'm nauseous and need something inhaled right away, to manage my symptoms. So I have disease control and I have symptom control that I use. I go through roughly 6 pounds of raw material every single month. And if I were to have proper dosing, it would be about 11 pounds. And I rotate between 14 strains when I optimally can. I can't always do it because our laws are becoming more and more regressive. Colorado's program used to be very good, very liberal, to where patients actually could heal themselves, but now not so much. Some of these other states with these ridiculous programs that aren't even working are starting to have better laws than we do. So as your states are going through this and you are legalizing recreational and you're legalizing your medicinal programs and things like that, keep in mind that people are going to try to push recreational and medicinal together under one retail marijuana framework. And we've seen this in a lot of states already. 9 states have already started talking to us about, oh my God, what's going on? What can we do? This is the pushback that we're seeing, and this is what we're anticipating. It's not going to be in any of your bills. Of course, it's not going to look like anything's going to touch each other. But what happens is they etch away at it very slowly. So if you don't have patient protections for patients who need incredibly large amounts of marijuana, you're going to screw over your patients by using a retail framework, because that retail framework ultimately is going to have less selection, may have a potency cap on it, and it's going to be taxed to where it's going to be a rich person's treatment. And really, it's boiling down to being a rich person's treatment right now. This is a plant that grows in your backyard. You don't even have to water it half the time. It's a weed. It really is. I know we have all these grow books and it's supposed to be very difficult to grow. No, it's not. You stick it outside in the soil. Why are we keeping this from patients? And why are we restricting patients because people want to get a buzz? Why not put the proper things in place in both the recreational bills and the medical bills to make sure that both the patients and the recreational users are covered? Just saying, food for thought.